The charge nurse is making patient assignments for the day shift. Which patient should be assigned to an RN who is pregnant? A 32-year-old male with measles. B. A 67-year-old female with shingles. C. A 42-year-old female with vancomycin-resistant enterococcus. D. A 24-year-old male with chicken pox. Correct answer is C. A 42-year-old female with vancomycin-resistant enterococcus. Rationale: the National Institute for Occupational Safety and Health lists 17 diseases that pregnant nurses should not be in contact with. These include airborne diseases such as chicken pox and shingles, as well as other airborne diseases like tuberculosis and measles. Vancomycin-resistant Staphylococcus aureus, VRE, and methicillin-resistant S. aureus are spread by direct contact, and standard precautions taken by all nurses are sufficient in preventing transmission. Thus, patients with these diseases are considered safe for a pregnant nurse to take care of. The nurse is caring for a patient with intractable nausea and vomiting. The patient has a temperature of 99 degrees Fahrenheit, a pulse of 100, a respiratory rate of 24, a blood pressure of 90/60, and oxygen saturation of 91%. What is the first action the nurse should take? A. Start an IV of normal saline. B. Administer ondansetron 4 mg IV. C. Apply oxygen at 2 liters per minute per nasal cannula. D. Make sure the wall suction is fully functioning. The correct answer is D. Make sure the wall suction is fully functioning. Rationale: airway patency is the priority for this patient, and the first thing the nurse should do is take measures to ensure the airway will be patent by making sure suction is readily available. Intractable nausea and vomiting pose a safety risk for aspiration. The other choices are all acceptable actions, but ensuring there is a patent airway is the first thing the nurse should do. The nurse is caring for a newly admitted patient with increasing dyspnea, hypoxia, and dehydration, who has possible avian influenza. Which of these prescribed actions will the nurse implement first? A. Start oxygen using a non-rebreather mask. B. Infuse 5% dextrose in water at 100 ml per hour. C. Administer the first dose of oral oseltamivir. D. Obtain blood and sputum specimens for testing. The correct answer is A. Start oxygen using a non-rebreather mask. Rationale: because the respiratory manifestations associated with avian influenza are potentially life-threatening, the nurse's initial action should be to start oxygen therapy. The other interventions should be implemented after addressing the patient's respiratory problems. The nurse is caring for 4 patients who are receiving IV infusions of normal saline. Which patient is at highest risk for bloodstream infection? A. The patient with an implanted port in the right subclavian vein. B. The patient who has a midline IV catheter in the left antecubital fossa. C. The patient who has a non-tunneled central line in the left internal jugular vein. D. The patient with a peripherally inserted central catheter line in the right upper arm. Correct answer is C. The patient who has a non-tunneled central line in the left internal jugular vein. Rationale: according to the Centers for Disease Control and Prevention guidelines, several factors increase the risk for infection for this patient. Central lines are associated with a higher infection risk, jugular vein lines are more prone to infection, and the line is non-tunneled. Peripherally inserted IV lines such as PICC lines and midline catheters are associated with a lower incidence of infection. Implanted ports are placed under the skin and are the least likely central line to be associated with catheter infection. A patient has been diagnosed with disseminated herpes zoster. Which personal protective equipment will the nurse need to put on when preparing to assess the patient? Select all that apply. A. Surgical face mask. B. N95 respirator. C. Gown. D. Gloves. E. Goggles. F. Shoe covers. The answer is B. N95 respirator, C. Gown, and D. Gloves. Rationale: because herpes zoster is spread through airborne means, and by direct contact with the lesions, the nurse should wear an N95 respirator, or high-efficiency particulate air filter respirator, a gown, and gloves. Surgical face masks filter only large particles and do not provide protection from herpes zoster. Goggles and shoe covers are not needed for airborne or contact precautions. Hospitalized 88-year-old patient who has been receiving antibiotics for 10 days tells the nurse about having frequent watery stools. Which action will the nurse take first? A. Notify the healthcare provider about the stools. B. Obtain stool specimens for culture. C. Instruct the patient about correct hand washing. D. Place the patient on contact precautions. The correct answer is D. Place the patient on contact precautions. Rationale: the patient's age, history of antibiotic therapy, and watery stools suggest that he may have Clostridium difficile infection. The initial action should be to place him on contact precautions to prevent the spread of C. difficile to other patients. The other actions are also needed and should be taken after placing the patient on contact precautions. When the community health nurse is counseling a patient who has an acute Zika virus infection, which information is most important to include? A. Drink fluids to prevent dehydration. B. Use acetaminophen to reduce pain and fever. C. Apply insect repellent frequently to prevent mosquito bites. D. Symptoms of Zika infection include fever, red eyes, rash, and joint pain. The correct answer is C. Apply insect repellent frequently to prevent mosquito bites. Rationale: prevention of Zika transmission is the priority, because Zika infection usually causes a relatively mild and short-duration illness. Because mosquitoes spread Zika infection from infected individuals to others, it is essential that the patient use insect repellent consistently during the active infection. The other information is correct, but will not assist in decreasing the risk to the community. A patient who has been diagnosed with possible avian influenza is admitted to the medical unit. Which prescribed action will the nurse take first? A. Place the patient in an airborne isolation room. B. Initiate infusion of 500 milliliters of normal saline bolus. C. Ask the patient about any recent travel to Asia. D. Obtain sputum specimen and nasal cultures. The correct answer is A. Place the patient in an airborne isolation room. Rationale: the initial action should be to prevent transmission of avian influenza to other patients, visitors, or healthcare personnel using airborne, contact, and standard isolation precautions. Initiating IV fluids, determining whether the patient has been exposed to avian influenza through travel, and obtaining cultures are also appropriate, but the highest priority is to prevent spread of infection. The nurse in the clinic has 4 patients waiting to be seen. Which patient should the nurse see first? A. Patient who has a 16 mm induration after a tuberculosis skin test. B. Patient who has human immunodeficiency virus and a low CD4 count. C. Patient who has swine influenza and reports increased dyspnea. D. Patient who has been exposed to Zika virus and has a rash and joint pain. The correct answer is C. Patient who has swine influenza and reports increased dyspnea. Rationale: the patient with increased dyspnea should be seen first because rapid actions such as oxygen administration and IV fluids may be needed. The other patients will require further assessment, counseling, or treatment, but they do not have potentially life-threatening symptoms or diagnoses. The nurse is caring for a patient who has been admitted to the hospital with a leg ulcer that is infected with vancomycin-resistant Staphylococcus aureus. Which nursing action can be assigned to an LPN/LVN? A. Planning ways to improve the patient's oral protein intake. B. Teaching the patient about home care of the leg ulcer. C. Obtaining wound cultures during dressing changes. D. Assessing the risk for further skin breakdown. The correct answer is C. Obtaining wound cultures during dressing changes. Rationale: LPN/LVN education and scope of practice include performing dressing changes and obtaining specimens for wound culture. Teaching, assessment, and planning of care are complex actions that should be carried out by the RN. The nurse is caring for a client receiving morphine sulfate intravenously for pain. Because morphine sulfate has been prescribed for this client, which nursing action should be included in the plan of care? A. Encourage fluid intake. B. Monitor the client's temperature. C. Maintain the client in a supine position. D. Encourage the client to cough and deep breathe. The correct answer is D. Encourage the client to cough and deep breathe. Rationale: morphine sulfate suppresses the cough reflex. Clients need to be encouraged to cough and deep breathe to prevent pneumonia. The remaining options are not specifically associated with this medication. The client with myasthenia gravis is receiving pyridostigmine. The nurse monitors for signs and symptoms of cholinergic crisis caused by overdose of the medication. The nurse checks the medication supply to ensure that which medication is available for administration if a cholinergic crisis occurs. A. Vitamin K. B. Acetylcysteine. C. Atropine sulfate. D. Protamine sulfate. The correct answer is C. Atropine sulfate. Rationale: the antidote for cholinergic crisis is atropine sulfate. Acetylcysteine is the antidote for acetaminophen. Vitamin K is the antidote for warfarin, and protamine sulfate is the antidote for heparin. Meperidine hydrochloride is prescribed for the client with pain. Which should the nurse monitor as a side effect of this medication? A. Diarrhea. B. Urinary frequency. C. Hypertension. D. Urinary retention. The correct answer is D. Urinary retention. Rationale: meperidine hydrochloride is an opioid analgesic. Side effects of this medication include respiratory depression, orthostatic hypotension, bradycardia, drowsiness and mental clouding, constipation, and urinary retention. A provider initiates carbidopa/levodopa therapy for the client with Parkinson's disease. A few days after the client starts the medication, the client complains of nausea and vomiting. What should the nurse tell the client regarding how to avoid side effects when taking carbidopa/levodopa? A. Taking an antiemetic is the best measure to prevent the nausea. B. Taking the medication with food will help to prevent the nausea. C. This is an expected side effect of the medication and will decrease over time. D. The nausea and vomiting will decrease when the dose of levodopa is stabilized. The correct answer is B. Taking the medication with food will help to prevent the nausea. Rationale: if carbidopa/levodopa is causing nausea and vomiting, the nurse would tell the client that taking the medication with food will prevent the nausea. Additionally, the client should be instructed not to take the medication with a high-protein meal, because the high protein will affect absorption. Antiemetics from the phenothiazine class should not be used, because they block the therapeutic action of dopamine. Mannitol is being administered to a client with increased intracranial pressure following a head injury. The nurse assisting in caring for the client knows that which indicates the therapeutic action of this medication. A. Prevents the filtration of sodium and water through the kidneys. B. Prevents the filtration of sodium and potassium through the kidneys. C. Decreases water loss by promoting the reabsorption of sodium and water in the loop of Henle. D. Induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. The correct answer is D. Induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. Rationale: mannitol is an osmotic diuretic that induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. It is used to reduce intracranial pressure in the client with head trauma. Neuroleptic malignant syndrome is suspected in a client who is taking chlorpromazine. Which medication should the nurse prepare in anticipation of the prescription to treat this adverse effect related to the use of chlorpromazine? A. Protamine sulfate. B. Bromocriptine. C. Phytonadione. D. Enalapril maleate. The correct answer is B. Bromocriptine. Rationale: bromocriptine is an anti-Parkinsonian prolactin inhibitor used in the treatment of neuroleptic malignant syndrome. Protamine sulfate is the antidote for heparin overdose. Vitamin K is the antidote for warfarin overdose. Enalapril maleate is an antihypertensive, used in the treatment of hypertension. A client is placed on chloral hydrate for short-term treatment. Which nursing action indicates an understanding of the major side effect of this medication? A. Monitoring neurological signs every 2 hours. B. Monitoring the blood pressure every 4 hours. C. Instructing the client to call for ambulation assistance. D. Lowering the bed and clearing a path to the bathroom at bedtime. The correct answer is C. Instructing the client to call for ambulation assistance. Rationale: chloral hydrate causes sedation and impairment of motor coordination, therefore, safety measures need to be implemented. The client is instructed to call for assistance with ambulation. Options A and B are not specifically associated with the use of this medication. Although option D is an appropriate nursing intervention, it is most important to instruct the client to call for assistance with ambulation. A hospitalized client is having the dosage of clonazepam adjusted. The nurse should plan to implement which action? A. Weighing the client daily. B. Observing for ecchymosis. C. Instituting seizure precautions. D. Monitoring blood glucose levels. The correct answer is C. Instituting seizure precautions. Rationale: clonazepam is a benzodiazepine used as an anticonvulsant. During initial therapy and during periods of dosage adjustment, the nurse should initiate seizure precautions for the client. A client with Parkinson's disease has been prescribed benztropine. The nurse monitors for which gastrointestinal side effect of this medication? A. Diarrhea. B. Dry mouth. C. Increased appetite. D. Hyperactive bowel sounds. The correct answer is B. Dry mouth. Rationale: common GI side effects of benztropine therapy include constipation and dry mouth. Other GI side effects include nausea and ileus. These effects are the result of the anticholinergic properties of the medication. The nurse has given medication instructions to a client, beginning anticonvulsant therapy with carbamazepine. The nurse determines that the client understands the use of the medication if the client knows to perform which activity? A. Use sunscreen when outside. B. Drive as long as it is not at night. C. Discontinue the medication if fever or sore throat occurs. D. Keep tissues handy because of excess salivation that may occur. The correct answer is A. Use sunscreen when outside. Rationale: carbamazepine acts by depressing synaptic transmission in the central nervous system. Because of this, the client should avoid driving or doing other activities that require mental alertness until the effect on the client is known. The client should use protective clothing and sunscreen to avoid photosensitivity reactions. The medication may cause dry mouth and not excessive salivation. The medication should not be abruptly discontinued because it could cause return of seizures or status epilepticus. Fever and sore throat should be reported to the healthcare provider. A client with vascular headaches is taking ergotamine. Which client complaint should the nurse monitor? A. Constipation. B. Hypotension. C. Dependent edema. D. Cool, numb fingers and toes. Correct answer is D. Cool, numb fingers and toes. Rationale: ergotamine produces vasoconstriction, which suppresses vascular headaches when given at a therapeutic dose range. The nurse monitors for hypertension, cool, numb fingers and toes, muscle pain, and nausea and vomiting. A client with narcolepsy has been prescribed a central nervous stimulant. The client complains to the nurse that he cannot sleep well anymore at night and does not want to take the medication any longer. Before making any specific comment, the nurse plans to investigate whether the client takes the medication at which time schedule. A. After dinner each day. B. Just before going to bed. C. 2 hours before bedtime. D. At least 6 hours before bedtime. The correct answer is D. At least 6 hours before bedtime. Rationale: a central nervous system stimulant acts by releasing norepinephrine from nerve endings. The client should take the medication at least 6 hours before going to bed at night to prevent disturbances with sleep. Taking the medication at the time frames indicated in options A, B, and C will prevent the client from sleeping because of the stimulant properties of the medication. Nurse is caring for a client with myasthenia gravis who has received edrophonium intravenously to test for myasthenic crisis. The client asks the nurse how long the improvement in muscle strength will last. The nurse's response is based on the understanding that the duration is usually how many minutes? A. 5 minutes. B. 15 minutes. C. 30 minutes. D. 60 minutes. Correct answer is A. 5 minutes. Rationale: edrophonium may be given to test for myasthenic crisis. Most myasthenic clients show a significant improvement in muscle tone within 30 to 60 seconds after injection, and the muscle improvement lasts 4 to 5 minutes. The client is taking trihexyphenidyl for the treatment of Parkinson's disease. The nurse should monitor for which side effect of this medication: A. Diarrhea. B. Urinary retention. C. Urinary incontinence. D. Excessive perspiration. The correct answer is B. Urinary retention. Rationale: trihexyphenidyl is an anticholinergic medication. Because of this, it can cause urinary hesitancy and retention, constipation, dry mouth, and decreased sweating as side effects. A client began taking amantadine approximately 2 weeks ago. Which decreased symptom should the nurse expect to see if the medication is having a therapeutic effect? A. Decreased voiding. B. Decreased blood pressure. C. Decreased rigidity and akinesia. D. Decreased white blood cell. The correct answer is C. Decreased rigidity and akinesia. Rationale: amantadine is an anti-Parkinson agent that potentiates the action of dopamine in the central nervous system. The expected effect of therapy is a decrease in akinesia and rigidity. Leukopenia, urinary retention, and hypotension are all adverse effects of the medication. A client receiving therapy with carbidopa/levodopa is upset and tells the nurse that his urine has turned a darker color since he began to take the medication. The client wants to discontinue its use. In formulating a response to the client's concerns, how does the nurse interpret this development? A. Indicative of developing toxicity. B. A harmless side effect of the medication. C. A result of taking the medication with milk. D. A sign of interaction with another medication. The correct answer is B. A harmless side effect of the medication. Rationale: with carbidopa/levodopa therapy, a darkening of the urine or sweat may occur. The client should be reassured that this is a harmless effect of the medication and its use should be continued. The client is receiving anticonvulsant therapy with phenytoin. The nurse plans to monitor the results of which laboratory test closely? A. Serum sodium. B. Serum potassium. C. Blood urea nitrogen. D. Complete blood cell count. The correct answer is D. Complete blood cell count. Rationale: the nurse would monitor the client's complete blood cell counts because hematological side effects of this therapy include aplastic anemia, agranulocytosis, leukopenia, and thrombocytopenia. Other values that warrant monitoring include serum calcium levels and the results of urinalysis and hepatic and thyroid function tests. The client is admitted to the hospital because of complaints of vomiting and abdominal pain. During data collection, the client tells the nurse that he is taking entacapone. Based on this finding, the nurse elicits information from the client regarding the presence of which condition? A. Hypertension. B. Hyperlipidemia. C. Parkinson's disease. D. Peripheral vascular disease. The correct answer is C. Parkinson's disease. Rationale: entacapone is an anti-Parkinsonian agent used in conjunction with levodopa to improve the quality of life in clients with Parkinson's disease. It is not used to treat cardiovascular disorders. The nurse is caring for a hospitalized child with a history of seizures who is receiving oral phenytoin sodium. Which should be included in the plan of care for this child? A. Monitoring intake and output. B. Providing oral hygiene, especially care of the gums. C. Administering medications 1 hour before food intake. D. Checking the heart rate before administering the phenytoin. The correct answer is B. Providing oral hygiene, especially care of the gums. Rationale: phenytoin sodium causes gum bleeding and hypertrophy, therefore, oral hygiene is important. Soft toothbrushes and gum massage should be instituted to reduce the risk of complications and prevent further trauma. Options A and D are incorrect because the intake and output, as well as heart rate, are not affected by this medication. Option C is incorrect because directions for administration of this medication include administering with food to minimize gastrointestinal upset. Carbidopa-levodopa is prescribed for a client with Parkinson's disease, and the nurse monitors the client for adverse effects of the medication. Which sign/symptom indicates that the client is experiencing an adverse effect? A. Pruritus. B. Tachycardia. C. Hypertension. D. Impaired voluntary movements. The correct answer is D. Impaired voluntary movements. Rationale: dyskinesia and impaired voluntary movement may occur with high levodopa dosages. Nausea, anorexia, dizziness, orthostatic hypotension, bradycardia, and akinesia are frequent side effects of the medication.